Hello, my name is Keonda Dunn, and I'm going to share with you the presentation. HT is a 23-year-old female that reports to the clinic with a chief complaint of I think I have herpes lesions in my mouth. HPI, a 23-year-old female comes into the office complaining of lesions in her mouth. She reports that the onset of these lesions is associated with discomfort and concern. The patient describes the lesions as painful, rating them 4 out of 10. She notes that a tingling sensation accompanied these lesions. She further reports experiencing a mild fever and generalized malaise, which she attributes to the oral lesions. The patient states that the lesions appeared approximately 3 days ago and have increased in number. She denies any prior history of similar oral lesions and mentions no known exposures to individuals with active herpes infection. She reports that she has been taking Tylenol for the pain and fever. She has a past medical history of hypertension, which is managed with hydrochlorothiazide. She's had chlamydia, mild depressive disorder, and sleep apnea, which all have resolved. She is currently taking 600 milligrams of Tylenol, POQ 6 hours PRN for pain and fever, and hydrochlorothiazide 10 milligrams POQ day. She does report having an allergy to penicillin, fur, and morphine. She does have some seasonal allergies to pollen and dust, which leads to some wheezing and difficulty breathing. She has a past surgical history of an appendectomy in 2022 and adenoidectomy in 2020. Her family history are relatively healthy, except for her father, who is 44 and has a diagnosis of hypertension, and her paternal grandmother passed away at the age of 75 of heart failure. Social history, exposure. She reports use of recreational cannabis and alcohol frequently. She resides in a one-bedroom apartment alone. She is single and has never been married. She is currently a college student. She is homosexual and actively engaged in sexual activity with 3 partners. She denies adhering to any safe sex practices, reporting and engaging in oral sex. Review of systems. General, she denies weight loss, fatigue, weakness, or chills, but reports a fever. HEENT, eyes, denies visual loss, blurred vision, or double vision, or yellowing of the sclera. Ears, nose, throat, denies hearing loss, sneezing, congestion, runny nose, or sore throat. Mouth, she reports some lesions in the mouth cavity. Skin, denies rash or itching. Cardiovascular, denies chest pain, chest pressure, chest discomfort, and palpitations. Respiratory, denies dyspnea, cough, or difficulty breathing. Genitourinary, reports some burning cessation during urination along with some urinary urgency. Musculoskeletal, denies back pain, joint pain, or stiffness. She does report some muscle aches. Lymphatics, denies swollen lymph nodes. Reproductive, denies any ever being pregnant, reports that she is sexually active. She does note that she has some painful sores in the genital area, reports vaginal discharge is brown in color and has an odor. Her last menstrual period was 10/6/2023. Allergies, denies any history of asthma, hives, or eczema. Objective, vital signs are all stable except for her blood pressure, which is 136/87, heart rate 78. She has a elevated temp of 100.4, respirations 18, pulse ox 98% on room air, pain 4 out of 10. Her BMI is 23.5 with a height of 5'9" and a weight of 159 pounds. General, she appears well groomed and well maintained. HEENT, head is round and symmetrical, pupils are perla, no abnormalities noted to the eyes. Both ears were assessed. The tympanic membrane was pearly gray and no signs of redness. No redness or edema within the throat cavity. No nasal drainage found. The trachea was free to move and is midline. The nasal turbulence were assessed and were within normal limits. The mouth cavity had several characteristics of lesions that were painful in mouth and were painful on touch. Neck. The neck, it has full range of motion in all directions. The trachea is centrally aligned. There were no bruits detected in the carotid arteries, and there is no signs of cervical lymphadenopathy. Respiratory. Lungs were assessed, all clear in all bases upon auscultation. Chest wall expands normal. Cardiovascular, heart rate is regular, no gallops or murmurs noted. Female reproductive, she has some small painful blisters / lesions within the vagina and the vulva. Assessment. Lab diagnostics include sending cultures of the lesions of the mouth. Offered other STD testing but refused. Differential diagnosis include aphthous ulcers, which are canker sores, genital herpes, and oral candidiasis, which is thrush. Oral candidiasis, thrush, has been ruled out as this is a fungal infection, and she has a viral infection going on, and she doesn't appear to have any white creamy plaques and or patches within the oral mucosa. Genital herpes has been considered as genital herpes are followed with a fever and sores that are on the genitalia and other regions that include the mouth. Aphthous ulcers, canker sores, have been ruled out as these sores can be painful, but they are not contagious and can develop in the oral cavity. Plan. Administer 400 milligrams of acyclovir BID times 7 days. Continue to care for the lesions on the genitalia and making sure they are clean and dry. Educate on the importance of having only one sex partner and practice safe sex. Educate on the importance of not having any sex until the completion of antiviral and lesions are gone. Educate the importance of telling their partners to get screened and treated. Take all medications as ordered. Follow up in the clinic if your symptoms get worse, and report to the ER if your temperature exceeds 103 degrees.